Hi, my name is Romeric Marcier, and my presentation is entitled Improving Parents' Experience in the Pediatric Emergency Waiting Room, Researching the Most Optimal Design for an Information Tool. The work presented here is the result from the internship of Meert van Erde, student at the Amsterdam University, the Netherlands, that she made at Lille Academic Hospital in France. She was supervised by Linda Dusselier-Peute from Amsterdam University and by Jessica Shearer and myself from Lille Academic Hospital. For those of you who are parents, you may have the unpleasant experience of visiting the pediatric emergency department. You may have noticed, and the literature confirms that parents experience stress and tension in the PED because of the very nature of the visit. Having a child harmed or sick is stressful because of the unfamiliarity of the setting, because of the lack of information about what is happening in the unit and to your child, and finally, because of the long time you have to spend there. Those factors degrade parents' experience of the PED and are shown to hamper their relationship with the healthcare professionals. It may even lead to fights. In our hospital's PED, parents and patients have no way to get informed about the waiting process and waiting time. Healthcare professionals of our PED have expressed the need for providing information to the parents about the care process of the PED and about the time they have to wait there. They wanted a tool to be designed to display this information. But for the tool to be more likely useful and accepted by the parents, it must fit their characteristic and meet their needs. In this context, it is of course necessary to take into account the parents' input on what information to show and how to show it, for instance, using focus group. The WAIT project aims to identify the most optimal design for a tool aiming to give children, patients, and their parents sight on the information needed during their presence at the PED. Three sub-goals are pursued. What are the information needs of parents? How should the information in the tool be designed based on the interaction design principles? And what kind of media should be used to provide the needed information? The focus group method has been used to answer this question. To prepare the focus group, two exploratory interviews were performed. A hostess and a volunteer, both in charge of informing parents of children patients during their visit at the PED and of making their visit comfortable, were interviewed to better understand the problematic and get knowledge on the waiting and care process. Then, in order to fit the focus group, a benchmark and a literature review were performed to identify the features and the information considered useful during waiting at the emergency department. This list was discussed to determine the items that could be relevant in the Lille PED context till a consensus arose. The final list consisted of 16 types of information and features. Initially, three focus groups based on the design studio method were planned. The goal was to explore the opinions and motives of parents regarding the most optimal information tool. 6 parents were recruited per focus group. The main inclusion criterion was to have a child under 16 age limit to go to the PED in France. The focus groups were conducted in 2 stages. First, based on the list of information and features, the participants had to vote for the information and features they wanted to see on the tool and for the kind of media they preferred the information to be displayed on, large information screen or mobile application. Then, participants were divided into 2 equal teams. In each team, the participants were asked to individually sketch the information and features chosen on a paper mockup. They had to explain their individual mockup to their team. Based on the discussion, each team had to draw a new mockup. Secondly, each team was asked to present and explain its mockup to the whole group. Finally, together, all participants were asked to find a compromise between the best ideas emanating from the 2 teams and to collectively design the final mockup. 3 authors of this communication revised and digitalized the mockups designed by the participants, considering the interaction design principles by Bastian and Scapin. The result consisted in one main screen and of 2 versions of a second screen. To validate that the digitalized mockup meets parents' expectations, an online questionnaire was sent by email to the participants of the focus group and to persons who know little PED but who did not take part to the focus group sessions. The purpose of the questionnaire was to investigate whether the mockup was understandable, playful, clear, satisfying, and contained relevant information. We used a 5-point Likert scale and 3 input fields. Results. As many others, this research has been impacted by the restrictions of circulation and meetings imposed to limit the dissemination of COVID-19 during the first semester of 2020. Only one focus group has been performed. During the first part of the focus group, participants expressed that they would prefer a large-size screen to display the information in the PED rather than a mobile phone screen. One of the most important arguments was that on a large-size screen, information is visible for everyone, including the healthcare staff. One example of an argument against the use of a smartphone application was that parents are occupied with a child and there is hardly any time to check this device regularly for information when they are at the PED. As for the information and features wanted to have on the screen, the idea of a serious game received the most votes because participants thought it was essential to entertain the children at the PED. In addition, there was an interest in explaining the care process and the different exams. Finally, participants believed that the parents should be able to identify themselves in the care process and see what the position is in the waiting queue. In the mock-up's design in the second part of the focus group, the following most important information needs were visualized. The information must be divided into two screens, one that represents the care path to be followed and one that represents more information about the waiting process. On the screen providing information about the care process, videos must be used to help understand its different steps. Those videos must alternate with a screen representing the process to be followed. On the left is a picture of a paper mockup designed by the participants, and in the center, its digitalized version. On this screen, the visualization of the care process is maintained by a road that shows the way through the process represented by a childish city. Each step of the process is visualized by a building and a sign that displays its name. Each child is represented by an avatar. The background of the avatar indicates the child's agency by means of the color. The anonymity of the patients is maintained by the chosen avatar and nickname. Their avatar leads the patients through the care process. On the screen dedicated to the explanation of the waiting process, patients can see their position in the waiting queue at each step along with the number of patients concerned by the step. They are enabled to identify themselves thanks to the avatars and see the progression while respecting privacy. Finally, participants highlighted that the screen must have a playful ambience that suits children. For instance, the screen displaying the care process as a cartoon style. Some elements of nature can be found on the screen to make the general ambience playful. However, not too many elements have been added for the screen not to be overwhelmed by too much information. Besides, this screen has two versions to make the interface more realistic, a day version and a night version. 10 persons, including 5 non-participants of the focus group, evaluated the digitalized mockup. For the first screen, the one depicting the care process, despite some slight differences, both groups were very much in agreement with the 6 items. They find the screen understandable with a clear description of the path through the care process, presenting relevant information, and with an ambient design that suits the PEDs. Overall, this screen satisfied them. As for the second screen, the one explaining the waiting process, participants expressed a clear preference for the second version because it is more quickly to understand compared to version 1. Participants found the interface understandable, presenting relevant information, playful, with a design ambience fitting the PED. They were satisfied with the screen. Discussion. The purpose of this research was to determine the information needs of parents of PED patients and find out the most optimal design for an information tool to be used in the PED at Lille Academic Hospital. Results from a focus group shown that there is a need for getting information on the care process, for visualizing this process, and for being able to identify oneself in the process. The final mock-up of this research includes two screens alternating on a large TV screen. The first one displays the care process to be followed thanks to an analogy with a childish city and alternated with educational videos about the different steps to be met. The second screen provides more details on the waiting process and on the position of the patients in comparison to others. In both screens, patients' anonymity is maintained thanks to avatars chosen by the patients themselves. By providing information that explains the PED care process, the patient and parents' experience and satisfaction might be improved, which might contribute in turn to improve the quality of the relationship between parents and care professionals. A result from the focus group was that participants preferred that the information is displayed on a large screen rather than on a smartphone screen. This was unexpected because it goes against the current trend of individualizing information on a smartphone. This choice would allow all people waiting in the emergency department to share the same view of the PED service and its occupation rate, which might support a collective awareness. Besides, initially it was envisioned that the waiting time would be presented as indicated by the literature. However, participants realized that waiting time can change as a result of changes in patients' prioritization, which in turn is determined by the arrival of other patients or changes in patients' conditions. In order to ensure that a change in waiting time would not cause frustration or anger, participants made the decision not to display the waiting time on the screen. This study has several limitations that must be kept in mind. In the first part of the focus group, participants considered that children should be kept occupied by means of a serious game. The idea of a serious game was not included in the mock-up design part of the focus group because of the difficulty to sketch a game during a focus group and to develop it during the project time. Second, initially 2 more focus group sessions were planned to ensure the completeness of the data collected. Unfortunately, due to the restrictions of circulation imposed to limit the dissemination of COVID-19 in France, the other sessions could not take place. Although it is possible to conduct online focus group with remote participants, this option was not chosen because of the technical biases that would have limited the interactions between participants and thus the collective creativity. Future steps of the project are first to conduct research on the content of the pedagogical videos and on the serious games that could be developed to fit the context of Lille Academic Hospital PED, and then to proceed to a large evaluation with end user of the actual usefulness, completeness, and understanding of the information presented and of the graphic interface. Thank you for your attention.